Hi, I'm Abigail Williams. I'm a pharmacist doing a residency with HARPS and the UAMS College of Pharmacy. Today, I'm joining the UAMS Centers on Aging for more information about medications in senior adults. Our topic today will be food and medication interactions. Food-drug interactions are not something that we often think about, but just like medications can interact with each other, food and drinks can also have interactions with medications. The most common example of this is grapefruits and statin for cholesterol. This video will mention several medications and food interactions to keep in mind. As I mentioned before, the interaction between grapefruit and statin medications for high cholesterol, including atorvastatin, rosuvastatin, and simvastatin, is usually the first medication and food interaction that comes to mind. A good rule of thumb, if you take one of these medications, is to limit the grapefruit to 1 grapefruit or 1 cup, 8 ounces of grapefruit juice daily. Another medication that has interactions with food is Warfarin or Coumadin, a blood thinner. Foods with high amounts of vitamin K like leafy greens and green tea, as well as alcohol, and foods with higher levels of protein can have an interaction with warfarin. While it's not necessary to completely avoid these things in your diet, if you take warfarin, consistency is key. For example, if you eat a spinach salad and have a glass of wine once a week, remain consistent with this intake. Talk to your doctor or pharmacist if you start using protein shakes in your diet, as these might change your INR. Drugs for low thyroid, like levothyroxine or Synthroid, also have interactions with food to keep in mind. This medication is sensitive and is best taken on an empty stomach. Dairy and calcium particularly affect levothyroxine and should be avoided for at least 4 hours before taking levothyroxine or 1 hour after taking levothyroxine. Blood pressure medications called ACE inhibitors, usually ending in pril, like lisinopril, or angiotensin receptor blockers, usually ending in sartan, like losartan, have interactions with some salt substitutes. Be careful to avoid salt substitutes with high levels of potassium if you're taking one of these medications. If you're not sure if the salt substitute you're looking at has too much potassium, ask your pharmacist to review the label with you. Antibiotics like levofloxacin and tetracycline can also have interactions with certain foods. Many antibiotics should not be taken with dairy or other foods high in calcium. A good rule of thumb with antibiotics and calcium or dairy products is to take the antibiotic at least 1 hour before or 2 hours after consuming dairy or calcium. This is a sampling of the most common food-drug interactions. There are others, so be sure when you get a prescription to read the information provided or talk with your pharmacist about any foods you should avoid. That brings our talk today to an end. Remember that you can always ask your pharmacist about food-drug interactions if you have any questions or concerns. Please message or comment with any questions and be sure to join us the next time for more tips about your medications.